We're going to get straight on with the Chuckle brothers because they are back. Here they are, Professor Whitty and Vallance. They've published a new report which is supposed to be for the future chief medical officers to deal with COVID and so on. But they're talking about a prolonged period of excess death. So we'll come on to exactly what they say in a second. But this, of course, is the latest from the Office for National Statistics, and we have another week of excess mortality compared to the 5-year average. But you know, well, it was very interesting looking this report that Whitty and Vallance have released. It was supposedly from the Department of Health and Social Care. So I had a look at the Department for Health and Social Care's Twitter feed to see if I could find the report itself. No, of course not. I couldn't, but I was told I needed to get boosted. I was also told that £22.5 million is going to research into cancer to develop new immune-based cancer therapies. This, of course, means mRNA. And I was also told that the NHS is delivering on its winter plan because, of course, the Tories deliver on everything. And they've established 40 healthcare traffic control centres. And that's dedicated 24/7 teams, helping to get patients into beds as quickly as possible. So there's 40 healthcare traffic control centres, pioneering centres which are using data to respond to emerging challenges. So no extra beds. That's going to deal with data, and that's really important. This move is part of the NHS's wider winter plan, is published in October, which also included the rollout of national falls response team services, new hubs dedicated to serious respiratory infections, and statistics also showed that more than 19 and 20 adult general and acute beds were occupied in the week to 20th of November. This is what Steve Barclay had to say, the Health Secretary. It's absolutely vital we use the latest cutting edge technology and data to ensure the NHS is performing as efficiently and effectively as possible. So, Patrick, I don't know if you've got any thoughts on this initially, but it's just staggering to me that they shut down or at least they vastly reduced the number of beds in order to make social distancing possible for COVID, to deal with COVID. They're not bringing those beds back, but we're going to focus on making sure that they've got the data necessary in order to produce reports to tell us how long the ambulances are waiting in queues outside hospitals.
Yeah, it's, so they're stuck on stupid, basically. They've had all this time to reflect on this disaster. It's also the conspicuous absence of Whitty, Vallance, and Matt Hancock from the public view in the last sort of year or so, or a better part of a year. And all of a sudden they're coming back. I think there's maybe an attempt to rehabilitate these people and perhaps to rehabilitate their legacy, which is the total disaster, the unmitigated disaster that's COVID response in the UK. But the NHS, this is predictable what's happening because they created a problem, which is massive waiting lists, staff shortages, shortages of doctors, qualified doctors, in moving to telephone healthcare. So they've created this. So it's data, it's big data, and it's remote services, and it's basically treating the NHS not unlike big agriculture. So there's basically the way you treat livestock. And I'm not making a sort of crazy flippant comparison there. If you look at how things have changed in the NHS in terms of the personal care that's being delivered or access to actual doctors, it is moving in the direction of big agriculture in the way that they're administering it. So this is the realm of the technocrats. It's all about big data, and they'll be with their PowerPoint presentations and new ways to move people through the system, or seem to be, but nobody's actually getting any actual health care, not of any high quality anyway. But it's a victory for the government because it's all about boasting lowering waiting times and the increasing efficiency and all of this stuff, but nothing about the actual quality of the healthcare that the individual is getting.
Indeed. So if the report from Whitty and Vallance wasn't on the Department of Health's Twitter feed, maybe it was on their website. So let's have a quick look there. Well, in fact, no, it's not there either. Maybe it's on the coronavirus COVID-19 page. Well, no, it's not there either. So how about the public health page? It's not there either. Eventually tracked it down on the Chief Medical Officer's annual reports page, which is buried on the government website, very hard to find. So let's just have a look and see what this technical report on the COVID-19 pandemic in the UK had to say about the excess mortality issue. And here it is. Healthcare professionals, says Chris Whitty and co, were working in highly pressured environments with potential significant exposure to transmission risk for a novel and largely unknown pathogen. So as Patrick has said, they are doubling down on this narrative as they try to rehabilitate themselves. Morale across the workforce was understandably closely linked to the overall direction of the pandemic and the broader public mood. But hold on a second. What drove the broader public mood? Well, in fact, it was Whitty, Vallance, the likes of Spy B and the SAGE team. So he can't blame the broader public mood for what happened in the NHS when it was him that set that. He goes on, there was a need to balance the need for surge and service adjustment to meet pandemic needs with maintaining an appropriate level of care and support for other health needs. But of course they didn't do that, because the first thing they did was to remove half the beds. I don't mean that literally, some quantity of beds, because they needed to distance people from each other in wards. We never actually discovered how many beds were removed over that period of time. Shifting to remote consultations, Patrick already mentioned that, and Debbie, of course, has been mentioning that for weeks, but he goes on. Shifting to remote consultations, discouraging unnecessary health setting presentations, and asking that those with specific symptoms avoid healthcare settings unless necessary has been an effective way to reduce potential transmission risks and additional burden during a time of significant pressure. Additionally, advice discouraging presentation in healthcare settings when people had certain symptoms needed to include caveats and routes for appropriate triage where these symptoms were not highly specific. But of course, that didn't happen either. Communications to discourage unnecessary visits to healthcare settings therefore needed to be continually adapted. Well, he may argue that he continually adapted his communications in this regard, but in fact, in practice, did people hear that, the subtlety of that? Well, I don't think they did. He goes on here, there's little doubt that delays in presentation, reductions in secondary prevention, postponement of elective and semi-elective care and screening will have led to later and more severe presentation of non-COVID illness, both during and after the first three waves. And he goes on, the combined effect of this will likely lead to a prolonged period of non-COVID excess mortality and morbidity after the worst of the pandemic is over. So, Patrick, let's have a guess how many times Chris Whitty mentioned the possibility that some of this excess mortality is related to the vaccine rollout. I'll let you guess that first before I comment further.
It's probably something between 1% and 0%. I don't know.
Well,
But
zero indeed, yes. But anyway, go ahead.
No, they're still, they won't say explicitly that the pandemic is over. There's still a lot of people referring to it. Certainly in the United States, they're clinging to it. The Biden administration will not admit that there's a pandemic that's over. They're just clinging to it. So we're in the latter stages of the pandemic, this kind of protracted end of the pandemic. This has gone on now for like a year or 2 years now. So how long is it? It's definitely going to stretch through this winter. We're not at the end yet. We're still in the pandemic. So all the emergency use authorization, this is basically a stay of execution for the kind of emergency authorization of the experimental mRNA gene jabs. That's all this is, because nobody wants to face the music, much less Chris Whitty or Vallance, the Chuckle brothers. They don't want to face the beast that they've created and the sort of potential tort tsunami coming in terms of lawsuits against the pharmaceutical companies, public health agencies, and so forth. All these people that are pushing and mandating this experimental pharmaceutical product. So I think that has a lot to do with it. So just the language, it says it all, Mike. What you just put there shows that they're still kind of drifting it on through the winter of 2022, 2023. And then what? Have to wait for another crisis to bury the last one? I don't know.
Yeah, well, indeed. Well, look, we'll come back onto the end of the so-called end of the pandemic later on in the programme. But if we've got excess mortality in the UK being caused by health care issues, there's certainly mortality building in Canada. Now, we talked about this briefly on last week's Extra, on last Friday's Extra, but Vanessa, we want to go into this in a little bit more detail.
Yeah, pretty horrifying. I mean, a number of independent media have picked it up and approached it from different angles.